So sickle cell disease is a devastating inherited blood disorder that disproportionately affects people of color. The most common manifestation of this condition is severe pain, which occurs episodically, and this often takes patients into the emergency room. We know that sickle cell disease is unfortunately also a disease of significant healthcare disparities, and patients often don't receive the care that they need in a timely fashion, and their pain remains uncontrolled. In order to improve the kind of care that we were providing these patients, our sickle cell program at UC San Diego Health established a same-day infusion program wherein we hope to take care of folks with acute pain events in the outpatient setting at our infusion center as opposed to having to go to the emergency room.
When the pandemic hit, it was a very interesting obstacle that was presented to our team of how we were going to get our patients treated for their uncomplicated vaso-occlusive crises in an outpatient setting rather than going to the ER. We got creative, and it was actually a really exciting merge between using telehealth in our outpatient infusion center to treat these patients. My main role was to help field the triage call from our nurse case manager, assess the patient, deem them appropriate for outpatient infusion center, and then place the orders with a pain plan that was specific for them and for them to come into the infusion center and get treated for their crisis.
So the real benefit to the patient is that with this improved workflow with the telehealth platform, we're able to get our patients in to be seen quicker. They no longer have to wait enormous times in the emergency department. And what we're really able to do here is provide individualized pain control.
Being in a sickle cell crisis isn't anything fun. And previously, when I used to go to emergency rooms, you face discrimination. Most of the times they think you're in there just chasing drugs or something, and that's totally not the case. It's like, I practically feel like I'm dying here, and the last thing I want to hear is you tell me, oh, I'm just seeking drugs, or you not take my pain seriously, But coming here, everybody understood what was going on. They understood sickle cell and what it was. And when you come into the infusion center, there's no stress involved. They just take you in and get you situated right away. It was one of the best experiences I've ever had as far as dealing with extra care where I needed to come in and see someone.
Since the program's inception, we've definitely learned a lot about sickle cell disease, how it affects the patients, how we can best provide them with pain relief or even services that they need outside of the same-day infusion.
So what we've seen as a result of implementation of our program is that our emergency room utilization has significantly decreased while our inpatient admissions have remained constant. And all of this has occurred in the context of us taking care of more patients with more infusion visits, all in the outpatient setting. So overall, the program has been really successful. So our next steps are to further expand the range of services that we provide, improve our telehealth model. We know there are more patients out there who could use our help, and we're happy to improve access to care for this population. And of course, our ultimate goal is to improve the quality of life for all individuals with sickle cell disease living in San Diego and in all of California.